There was a time when everything wasn't quite as it is today, when not everyone could go to every medical facility to get care. Stay with us when we talk about special hospitals for special populations in Louisville, Kentucky.
Kentucky Health addresses the healthcare concerns of all residents of Kentucky and surrounding states. It was created by Dr. Wayne Tuckson, a colorectal surgeon practicing in Louisville. Here is your host, Dr. Wayne Tuckson.
Hi, and welcome to another segment of Kentucky Health. Today we want to talk about special hospitals. And I'm not talking about hospitals that care for children or rehabilitation facilities, rather talking about hospitals that care for populations of people that are pretty unique. Though Louisville right now is a hub of major healthcare innovation and treatment, it hasn't always been open to everybody in our community. There was a time when African Americans couldn't necessarily go to hospitals for whites, and there was also a time when we had people up and down the river who needed special care that may not have been available to them at the local hospitals. These are the types of things we want to talk about today. And it's kind of interesting as we go back and look at the history of healthcare here in Louisville and in Kentucky in general. We have two guests with us today. Dr. Maury Weiss, who's a cardiologist here in town. Dr. Weiss, thank you for being with us today.
Pleasure.
And Dr. Charlie Smith, who practiced primary care, internal medicine, who's
Correct.
now retired,
Yes.
somewhat, I guess now. Charlie, thank you both. Thank you for being with us. Now let's start off. I guess I'm going to start off with you, Maury, if you don't mind.
Sure.
There was this time where African Americans or freed slaves even could not go to the regular hospitals here in town.
Absolutely. And it was the time I was in medical school, there was colored and white wards at the university hospital. It was called the General Hospital at that time. But there were few, if none, in some of the other hospitals, African American patients. It was just not available until the 60s in all practical purposes. And that sort of ties in with our story today.
In fact, Jewish Hospital was one of the first hospitals to admit African American patients, wasn't it?
And their staff consulted at the Red Cross Hospital, on, which we're going to talk about in a minute, the African American Hospital.
Now, before we get to that, Charlie, set the stage for me. There is this thing that's down in Portland that as you're driving down 64, is this beautiful building, and I understand that at one time that was so-called the Marine Hospital?
Correct. And that does not refer to U.S. Marines. That refers to people who work on the river, on the water. And the reason it's down there is that one time Louisville and Portland were separate cities because of the Falls of the Ohio. You had the portage of goods back and forth between the two cities. Mm-hmm. The reason it arose is that the United States felt its mariners were very important to it. And in 1798, President Adams started the first prepaid medical plan in the country. Each seaman had 20 cents deducted from his or her wages each month, and for that they received 4 months of hospitalization. First, they built hospitals on the coast, New York, Philadelphia, New Orleans, and so forth. But then in 1836, Senator Henry Clay of Kentucky said that the western waters were now full of commerce. The Portland Canal had been built around the Falls of the Ohio, and the commerce was flowing past Louisville. So he introduced a bill to build marine hospitals on the western waters, and 7 were built. And we happened to get one at Louisville, which was in Portland. And it was built between 1845 and 1852. And actually the year it opened, 1852, is the year that Louisville and Portland merged.
Now, so the only people that could go to this hospital were the sailors and seamen working up and down the river?
And other federal employees. For instance, when the Coast Guard came along, they took care of the Coast Guard. Then later, this was the predecessor for the Veterans Administration hospitals before there was a Veterans Administration. And it served that role very admirably after World War I.
What kind of illnesses were you seeing at these types of
Well,
hospitals?
most of the illnesses were trauma, because steamboating was a very dangerous occupation. Many steamboats blew up because they actually didn't know how to control the pressure. The average lifespan of a steamboat was 3 years. Of course, they could, after 2 trips from Louisville to New Orleans, they'd paid off the boat, so they could get by with that. Then,
what was the lifespan of a seaman then on the boat?
well, there was a lot of trauma and there were a lot of deaths. And the other thing is, remember, these people were moving from the climate of Louisville to the climate of New Orleans or up to Minneapolis, all in the space maybe of 2 weeks. So you had a lot of pneumonia. But the number one reason for admission in the 1870s was sexually transmitted disease.
Did they have ways to treat the patients then?
Yes, they did. They had various potions and devices, some of which we've been able to recover.
I would not want to have any devices. I'll stick with the potions. Maury, tell me, what led to the development of the Red Cross Hospital?
Well, the history of medicine in the African American community is very deep and very difficult for us to really sort out. But we know it started in the 1870s when a newly minted physician came from the University of Michigan and born in Detroit, Fitz Butler. He was the first African American graduate of the University of Michigan. He came to Louisville to start practice with his wife and 3 children because there were 28,000 African Americans in Louisville and not one African American doctor in 1872. He started a medical school, and as Dr. Flexner, Abraham Flexner, in his famous report said that this was arguably the best African American medical school, proprietary medical school in the country. Fitz Butler dies in 1901, but in 1896, Dr. Wiebe, who came to Louisville from Freedman Hospital after graduating from Howard, and 2 of his friends started a hospital at 6th and Walnut, which is now 6th and Muhammad Ali, catty-corner to the African American Insurance Company and where the Armory or Convention Center is now. It was a 2-story wooden walk-up home, and after 4 or 5 years they raised enough money and they moved to South Shelby Street. And when I started in practice, I'd see consultations there, and I was driving out South Shelby Street about 6 months ago, and I said, I'm going to stop in there and see if I can find the papers. It's now the Volunteers of America Hospital and Organization. And I found out that one of their therapists had studied the hospital, found a lot of papers, and some were out at U of L. And I suggested to them that we take out the cornerstone, because I saw a photograph by Judge Habron, the grandfather of the current Judge Habron, putting in a cornerstone in 1950 with that represents the building that's standing there now. That was the 4th building that was part of the Red Cross Hospital from 1905 until 1950. So I convinced the Volunteers of America board to let me take out that cornerstone, which we did, because in the photograph taken in 1950, it shows the head nurse putting in the stone a copper box with the time capsule and the history of the hospital. We got that out a month or so ago, and now I'm collecting that and a lot of other data, and we're going to write a really nice history of Red Cross Hospital and couple that with the Louisville National Medical College.
Who were seeing patients at this facility?
Okay. The doctors, the primary physicians were African American. But when I started in practice in 1962, there were consultants from the University of Louisville in radiology. Dr. J.T. Ling, who was professor of radiology, would go to Red Cross and read x-rays. My father, who was one of the first cardiologists in the country, would be called out there to read EKGs that they took. And he helped Dr. Rabb, the anesthesiologist, with difficult cases. They had surgical consultants and pathologists to read the slides. And most of these came from either the University of Louisville School of Medicine or Jewish Hospital Dr. Arnold Griswold, who was chairman of the Department of Medicine, Surgery at the university, was very active at the Red Cross Hospital. And they worked in tandem in the 40s, 50s, and 60s until, like you mentioned in your opening remarks, that African Americans could then be admitted to the hospitals around town, and that began the economic demise of Red Cross, because they didn't have the assets to buy the new X-ray equipment, fancy operating rooms that were in demand at that time.
As we think about now the cost of health care, who's going to pay for it? Who was paying for it back then?
The way the Red Cross from the very beginning said, anybody who needs help, we will see and cover their bill. And the African American community for 50 years would have church suppers, pie events, raised $20, $50, $100, and they kept the hospital going. And the churches would also contribute. It was a focus for the African American community they could take tremendous pride in. This was their hospital, and they supported it. And the doctors, of which there were maybe about a dozen, when I leave here, I've got to go over to Trayton Oaks to see the widow of Dr. Jesse Bell, who came to Louisville and helped rebuild the hospital in the 40s with the help of Rodney Lovell, because he was with the public health, who eventually went to Harvard as professor, but he was public health director here, like Troutman is now. He got famous during the 37 flood and the polio epidemic. Well, Dr. Bell, being an African-American physician and was working at Waverly Hills, worked with Lovell. And with Lovell's help and Dr. Bell, they rebuilt the hospital and refurbished it in the 40s and 50s. And Mrs. Bell will be 105 years old December 5th, and I'm going to go by and see her.
So that's amazing.
So I've got a history. I've lived through all this now, and now I'm digging up all the old photographs and everything.
Let's shift gears again. Let's go back to the Marine Hospital. What services, were you doing surgery at this facility?
Yes.
Or the whole gamut?
Right. Yeah, the operating room was on the third floor with a skylight, to provide enough illumination. And that we still have that in the restored roof we have now.
Wow.
And the surgery was performed by commissioned officers in the U.S. Marine Hospital Service. And this later became the U.S. Public Health Service. And actually developed out of that, the hygiene laboratory developed into the National Institutes of Health. And then they further developed the CDC, the Center for Disease Control. All that came out of the U.S. Marine Hospital Service, which we had right here. What was interesting is that Lister in Scotland and England came up with the theory of antisepsis, but the Eastern Seaboard in the United States did not accept this British idea very readily. After all, we were rebels. But the U.S. Marine Hospital Service did, and one of the first machines to spray phenol over the wound was developed by the U.S. Marine Hospital Service, and they decreed that you would practice sterility in surgery.
Now, if I'm not correct, you actually practiced at this facility.
But at a later date. What happened is, after the development of the Veterans Administration Hospital and the creation of one here after World War II, the federal government withdrew from both the old hospital and the new one they just built in 1935 in front. The city of Louisville acquired the whole campus, these two hospitals and the grounds, for $25,000 under Charlie Farnsley, a mayor famous in our past. And what the city did was create a hospital for chronic disease. Louisville has always taken care of its own, starting in 1820 with the first what they call Marine Hospital, because most of the sick folks were put off boats here, because if they couldn't work, they put them off. And so they started taking care of them. In 1852, when the U.S. hospital opened, they changed the name to the Louisville City Hospital. And
so that's not the Marine Hospital that we see down on 64?
No, it is not.
Okay.
But that hospital is why the medical center today is at Preston and Chestnut, because they picked a nice place in the country east of Louisville at that time for the patients. So the a thing the city did then was put in a hospital for chronic diseases, and it was staffed by the University of Louisville School of Medicine. So they had a position for a medical resident to live on the premises as the only MD, licensed MD. And I was privileged to get that for 2 years. I'd been in the Air Force already, and I was a little more mature than the other residents at the time, and had a family of 4 of us. We all lived there. I had 4 medical students who worked for me, and 1 dental student who ran the lab. We all ate together in the staff dining room and lived in the old building, which was really in terrific shape. The reason that's the only building left of those original 7 hospitals is that when they built the new building in 1935 in front, they kept the boiler to create hot water and heat in the basement of the old building, so they had to keep it intact. But it was chock full of residents. We had, for instance, the seamstress and the telephone operator, the lady who ran the laundry, the dietitian and her husband. All of us lived in that one building.
So you talk about the new building. Is that what is now the Portland Clinic?
Yeah, that's the Family Health Center and the Portland Clinic. And that's where the headquarters are of the 7 clinics in the Family Health Center system.
So that was what morphed, so from the Marine Hospital morphed into that particular facility now.
And this Hospital for Chronic Diseases existed for about 20 years. See, back then there were no loop diuretics like Lasix. You had to give diuretics by injection.
Oh.
So to keep people alive, we had a whole floor of congestive heart failure, and we could manage them with the diuretics and the drugs that went with it at that time. Then we had the first rehab unit. Fraser Rehabilitation had not been invented at that time, so we had quadriplegics and paraplegics as patients, and we rehabilitated them, and they moved on. And then we had 1 floor of dementia. Yeah, which was called back then cerebral arteriosclerosis. And the first antipsychotic, Thorazine, had been invented, so most of those folks had to take an antipsychotic. Because once the city let the contract lapse and the whole building was shaking with the movement on the 3rd floor.
So you had to do something to take care of those patients.
Right.
Were there, at this point then, could anybody in the city go to this facility?
Yes, once this occurred, then it was for anybody and everybody without any ability to pay or whatever. So these services provided much on the same basis as the Louisville General Hospital, which was the predecessor of our present University Hospital. Now, another thing interesting is that the Marine Hospital Service in the 1850s to the end of that period did accept African American patients, because a lot of them worked on the river, and they were eligible just like anybody else. So that particular hospital was integrated as to race throughout its history.
Did you
Before the Civil War.
before the Civil War?
I would like to say one thing, that Charlie Smith deserves an enormous amount of credit, the amount of time and energy he's put into preserving this structure, because it is the last remaining Marine hospital in the United States. And they had the best architects build them, and all the other ones along the coast and the Gulf Coast and the East Coast and up and down the rivers have been torn down. This exists as the only monument for that whole system of medicine that this country developed, starting with John Adams in 1798.
1798, yes.
That's amazing. I'm just curious about another population. Did we see other immigrants who, from say the Asian countries, coming to this facility also?
Well, yes, if they happened to be a member of the crew, and this did happen eventually, so that we had those people also.
Now, we were talking a little bit about who kept this hospital, the Red Cross Hospital, going, but you made mention of something before we started the show today about how sometimes you'd have benefactors who would come in to aid the Red Cross Hospital.
Right. The several wealthy families, in my research so far, the Binghams gave money. Judge Hayburn and his friends raised a lot of money to build this structure in 1950. But Mrs. Speed made this one of her own special projects. And every year, at the end of the year, if they were short, she wrote a check and would give, if they needed an x-ray machine, she'd purchase the x-ray machine. And in her will, she describes why she did this. And it was in honor of this woman who had been her housekeeper for many, many years. And she wanted to honor her, and she did.
Tell me about the quality of care at this facility compared to other hospitals around.
The quality of care was outstanding. I should have mentioned that the only African American nursing school in Kentucky was at Red Cross Hospital.
Really?
The staff founded it early on in the beginning of the 20th century, the doctors, and Mrs. Speed built the building to put the nursing students in that was just west of behind the hospital on the west side. And they sent several hundred African American girls to be nursing supervisors, nurses all around the state in this whole region. So that was a tremendous contribution that they made. And these women were well trained and were devoted to the care of patients. So the patients in this hospital got good food, loving care, and they also had the advantage of some very well-trained doctors. And if the doctors needed a certain amount of technology, like reading x-rays and things like that, there were enough non-African American physicians in the community to pitch in. And one of the reasons I got interested in this was because I looked at the list of doctors, and there are only 3 of us left alive that practiced there. Milton Young III, myself, and Albert Golden, who was a consultant in internal medicine. But all the African American physicians are gone. And so this is a chance to save the history of this institution, and I hope that it gets picked up and appreciated by the African American community, because they should be very proud of what they did to hold this together for 75 years. It opened in 1901. 1896, they got the idea. In 1899, they bought the house at 6th and Walnut and 6th and Muhammad. And then for the next 75 years, it was supported by the African American community, the churches, the ministers, all the other organizations that could give a little bit here and there. They were always involved during the flood of '37, polio epidemics, tuberculosis drives, and they were always part of that.
An integral part of the entire community.
Yeah, there was a connection. One of my best nurses when I was resident at the Marine Hospital was trained at Red Cross Hospital. Then I went into private practice and practiced at Jewish Hospital along with Maury. And she went there as a nurse and was eventually head of infection control there for years before she retired.
It's amazing. You know, as we think about modern day healthcare, especially here in Louisville, we think that this whole concept of the health center and Louisville being a center for development of, again, new technologies, I believe as the University of Louisville says, developing new technologies and teaching it on to other students. But I think all the hospitals here can be credited with doing new and great things in terms of helping the population of Louisville, but also the whole country. Many of us tend to think, the younger people tend to think that history begins the moment we show up. However, there's clearly been a long history of what's been going on as far as healthcare in Louisville based on what was going on at the Marine Hospital, and particularly what was based on over there at the Red Cross Hospital, taking care of all populations and all comers here in town. I just want to end this by asking just a simple question to you. You think we're all better for the experience of having a Red Cross Hospital?
Absolutely.
What about having the Marine Hospital?
Oh, absolutely. Yeah, even one of the surgeons who served out there, Henry Carter, is probably the man who really discovered the source of yellow fever in the mosquito.
Well, there you go. These 2 gentlemen also member of what? You do a history club, and when you talk about the history of medicine. So I'm going to encourage any of you who have any other information about other facilities throughout the Commonwealth. I want to make sure you get in contact with them. Or if you want to make sure I get it and pass it on to them, you can reach us at Kentucky Health at InsightBB.com. Again, Kentucky Health at insightbb.com, or try to reach these two guys, because I'm sure there are other stories out there throughout the Commonwealth of Kentucky. Thank you both for being with us.
We really need that.
And thank you all for joining us on this session.
Well,
of
thank you.
Kentucky Health.
Thanks.
Thanks, guys.